Hello, my name is Carolyn Merriman, and I'm one of the faculty at East Tennessee State University's College of Nursing. I'm going to demonstrate what a final head-to-toe exam looks like. During this exam, I will be doing the exam, and also I will be verbalizing my findings. You may find in your course that you're required to verbalize your findings, or that you're only required to document your findings.
Hello.
Hi, my name's Carolyn Merriman. I'm going to be your nurse today. Can you please tell me your name?
Sure, it's Marcy Smith.
Hi, Marcy. Is that okay if I call you Marcy?
Sure.
Okay, thank you. Well, today I need to do a head-to-toe exam, so I'll be checking eyes and ears, your heart, your lungs, your abdomen, and your muscle strength. Do you have any questions before we begin?
No.
You've already told me your name. Will you please tell me what time of day it is?
Sure, it's morning time around 10 o'clock.
Okay, and will you tell me where you are today?
We're at ETSU.
Okay, thank you. My patient's alert and oriented ×3. I think before we get started, I'm going to do your blood pressure. All right. Do you prefer one arm over the other?
Oh, this one's fine.
Okay, it's closest to our machine here. Okay, and let me just get a pillow so it's at arm. Your arm is at heart level. Alrighty. I could do this by electronic, but I have a manual, so that's what I'm going to do. Okay, palpating your brachial artery, that's how I lined up this cuff. It was 100/60. Is that what it usually runs? Mm-hmm. Okay, thank you. All right, so the next thing I'm going to do is just start with your eyes. And I see that your eyebrows are symmetrical, your eyelashes are full, your sclera is clear, your conjunctiva, let me double check that. Can you pull your lids down for me? Okay, pink. Your eyes look moist. Your corneas look also clear. Now I want to check your pupils to see their size. Just look straight ahead. They're about a 4 on both sides, so they're symmetrical. Now I'm going to shine the light into your eyes. Just look straight ahead. Okay. Excellent. They constrict on each side at the same time. When I put it in one, it goes in the other. Now I want to check your eyes for accommodation, so look straight ahead. And when I put my pen light in front of you, please look at that. Okay, look at the pen light. Okay, so your eyes accommodate by constricting. All right, the next thing we're going to do is look at your ears. Okay, so let's see. Your ears are even colored, tanned. There's no deformities that I can see. They're rounded in shape, and there's no lesions on them, no drainage from the internal ear. Same thing, let's look. Rounded on your right side, even in color, tanned, no lesions, no deformities. I don't see any kind of drainage coming from that ear. Now I need to just check out your mouth. Your lips are pink. They look pretty moist. Can you open your mouth, please? The upper part of your mouth, your upper palates are pink and moist. Inside of your cheeks, pink and moist. Can you say ah? And can you stick your tongue out, raise it up? Okay, and it looks like pink moist. Your teeth and gums look healthy. There's no missing teeth. There's no cavities, looking cavities. Your gums are not over your teeth. All right, so that looks like a pink moist and no lesions for your mouth. All right, next thing I'm going to do is just check your neck. And I'm checking for the carotid pulse, one at a time. Carotid pulse is 2+, which is normal. While I'm here at your neck, I'm going to check your trachea. Your trachea is midline. That is normal as well. All right, just going to gently pinch up a little skin to check for turgor. It is brisk, it snaps back quickly. Let me look at your arms now. if you don't mind. Thank you. All right, really looking at the front side of your arms and looking at the back side of your arms. The color is even and tanned. I don't see any vascularity or bruising or any lesions, cuts, scratches, insect bites. Now I'm going to touch it with the back of my hand. Warm, dry, and smooth texture on the anterior and posterior arms. Perfectly. Thank you. All right, so let me go ahead and look at your hands. Nails are no clubbing, left or right. Pressing down. Nails are firmly attached. The nails are rounded. They're pink in color. And the capillary refill is less than 3 seconds. Let me check your radial pulses while I'm here. Radial pulses are 2+ bilaterally. Let me check your hand grips, if you'll squeeze, please. Okay, excellent strength. I would grade that 5+. All right, now what I'm going to do is, if you don't mind, we'll raise the blanket, and I'm going to check the skin and different things on the bottom. All right, so your skin, I'm just looking first. It looks even tanned, like tan color. I don't see any lesions, bruises, vascularity on the front. Okay, looking on the back, the same. Smooth texture. Skin is warm and it's dry on both sides. Okay, check for edema here. Pressing 5 seconds. No pretibial edema. Let me check your pedis pulses, dorsalis pedis pulses. They're 2+ bilaterally. Okay, checking the cap refill in your toes, less than 3 seconds. Can you press on my hands? Plantar flexion is 5+. I'm going to go ahead and re-sanitize my hands. All right, the next thing we're going to do is go to some of the core organs. So we're going to start with respiratory. You can put your pants legs down. So I'm going to start with respiratory, and I'm just looking at your respiratory chest to make sure that you have even breathing.
Okay.
Will you take a deep breath, please?
Sure.
So I see a symmetrical rise and fall of your chest. Now I'm going to measure the anterior to posterior diameter is about half, but it's certainly less than transverse, which is across, so AP is less than transverse. Next, I'm going to listen to some breath sounds. So I'm going to listen to about 6 to 8 on the front, and then about 8 on the back, and then 1 underneath your right arm. Okay? Every place that I put my stethoscope, if you'll just take a deep breath.
Okay.
Okay? You doing okay?
Mm-hmm.
Okay, if you don't mind, if you'll cover, I'm going to go under. Okay, can
see,
you
it's
use just
okay.
this one?
Yeah, it's okay for now.
That's fine, just want to make sure you're covered. All right, so I'm going to do 2 sites underneath. Thank you. Perfect. All right, you can cover now. So anterior breath sounds are present. They're clear. The predominant sound is vesicular. There's no adventitious sounds, no rales, rhonchi, or wheezing. Can you please turn to the around?
Sure.
Thank you. And we'll take this cover to cover your back. Try to keep your privacy. All right, I'm just going to move your hair if that's okay. All right, so I'm going to start at the top. If you'll take a deep breath. Another one. Another one. You all right?
Yep.
Here. All right, now I'm going to raise your shirt. I've done 4 sites, but I want to do a few more. So do you mind just putting this over your shoulder?
Sure.
There you go. All right. Another one, please. Another one. Good. Another one. And one more. All right, that's perfect. Now what I want to do is just, while your arm is up, I'm going to do one underneath your arm. Okay, take a deep breath. And that's your lateral one. All right, so we've done your respiratory. The posterior and the lateral were also, breath sounds were present. They were clear. You can turn around now. There was no adventitious sounds, wheezing, rales, or rhonchi in any of the areas. All right, so I think what we'll do next is we're going to do the cardiac exam. So let me get set up here to help do that. Can you move your hair over that way? Okay. So to do the cardiac exam, first thing I want to do is just look across your chest. So I'm looking across. I don't see any heaves. I don't see any lifts. Now I'm going to place my stethoscope on 5 different areas and then stop and do an apical pulse and then listen with the backside too. That doesn't mean anything is wrong. I just need to listen carefully. Okay, thank you. Okay. Second intercostal space, right sternal border is aortic. Second intercostal space, left sternal border is pulmonic. Third intercostal space, left sternal border is herbs. Can you please cover yourself here and we will keep you draped here. Okay. This is the fourth intercostal space, left sternal border, tricuspid. Fifth intercostal space, midclavicular line. That's called the mitral. I'm going to stay here for 1 full minute. Okay, that's your heart rate was regular, and it was 66. Okay, now I'm going to go back and listen with the bell. Mitral, fifth intercostal space, midclavicular line, tricuspid, fourth intercostal space, left sternal border. We can go ahead and take the sheet down. Herbs. Third intercostal space, left sternal border. Pulmonic, second intercostal space, left sternal border. Aortic, second intercostal space, right sternal border. At each of the sites, I heard a distinct S1 and S2. It was a regular rate. I didn't hear any extra heart sounds. I didn't hear any splitting. I didn't hear any murmurs. So the next part of the exam is I'm going to go to your abdomen. So if you want to, we can keep this cover up and we'll keep you protected this way. Thank you for going back down in the bed. So you can go ahead and just expose whatever. Here we go. Thank you. All right. So I'm looking first down and across, and I'm looking for your contour. Your contour is flat. There's no extra pulsations and no peristalsis that I see. Your embolicus is midline. There's no drainage. There's no redness. Now I'm going to listen with my stethoscope in each of the 4 quadrants. Bowel sounds are present in all 4 quadrants and they're normal active. Okay, Now I'm going to just lightly press on your belly with one hand. Will you let me know if there's any tenderness? Okay, any tenderness?
Nope.
Okay, any tenderness? All right, I don't feel any guarding and I didn't feel any masses. Now I'm going to go with two hands a little deeper. Let me know if there's any tenderness. Okay. All right. I didn't feel any guarding. She said there's no tenderness. I didn't feel any masses and I didn't feel any enlarged organs. You may cover yourself up now. All right. So the last thing we're going to have you do is come over to the side of the bed.
Okay.
I'm just going to check your spine if you don't mind standing up.
Okay.
All right. So if you want to, you can hold this over you. And I'm just going to lift the shirt a little bit. The first thing, I'm just going to look as you're standing straight. I can kind of see, but I'm going to raise this one shirt up. Okay, I'm sorry. And then I'm palpating. When I palpate, is there any tenderness?
No.
Okay. Can you please bend over slightly? I don't see any scoliosis, lordosis, or kyphosis. All right. You can go ahead and sit down here on the bed. Do you have any questions for me?
No.
Okay, I think this concludes our head-to-toe physical exam. Thank you so much. I'm going to go clean my hands and I'm going to go document.
Okay, thank you.
You're welcome. This concludes our final head-to-toe exam demonstration.